online forum held in April, we're now planning to host 4 additional forums. In your chat bar coming up soon, you will see registration for our next forum. Obviously today, let me see if I can expand. Let's see here. Today's forum, keeping your employees safe while offering tours and services. On August 18th, we'll be holding our next one, managing disgruntled customers and staying positive during COVID-19. And the registration link is now in the chat. We'll have 2 more, one on September 9th around pivoting your business and tour products with a focus on fall and beyond. And then later in September, one related to financial resources, fundings, and other aspects for long-term financial success. Finally, next slide. We'd like to clarify our outcomes for these sessions. So for these forums, our outcomes and what we're hoping that you'll all have a chance to see is to receive technical guidance to support tour operators, guides, and outfitters, you all, your businesses, to safely operate during COVID-19, to share and hear about business experiences while seeking input from your industry peers. So really an engaged conversation, and to meet and network while doing it virtually with industry peers to support a more collaborative industry in Oregon. So with that, I'd like to introduce the Travel Oregon team. Behind the scenes, we have Travel Oregon's Hillary Sager, our product development coordinator, who's serving as today's technician, as well as Jordan is also on the line here, Jordan McCauley. Please post any questions or comments. If you're having any technical problems, either of them will try and support you in that effort. And then on the front of the house, I'd like to introduce Melanie Fisher of Consulting Sensei, who's helping us organize these forums and design the forum program, and will serve as today's forum moderator. So with that, we're really excited about today's program, and Melanie, why don't you take it away?
Awesome. Thank you, Scott, and thank you to everyone who is joining us today. We are super excited to offer these forums. And so the first one that we're doing, we have a presenter all the way from Brazil. Fabio Raimo de Oliveira is joining us, and will be speaking about effective approaches in the following categories that you can see on the screen. Fabio comes from the Adventure Travel Trade Association, and his background comes from field time as a guide, like many of us. He works with risk and safety management for tour companies. He has helped companies implement and refine their safety programs, and he is also the lead educator for the ATTA's online course that dives deeper into these subjects, and we will be sharing the links to that for those of you that are wanting to get more information. So we are super excited that Fabio will be joining us today. And then our program today is going to start with a conversation or a presentation from Fabio, followed up with some questions and answers. And so you will be able in the chat bar to put your questions in, which we will be monitoring, and we will try and answer as many as possible. So that is there for you to see. And then just to kind of swing back real fast, you will see that after we are done with Fabio's presentation, we are going to have some time for everyone to talk amongst yourselves. So first, it will be breaking you up by the types of business that you're all in, so you can kind of see how everyone is doing, what's working, what is not working, and we'll go into more details about the discussions for that. And following up, the final group that you'll be going into will be dividing you up by area. So those of you that are in Hood River will have a chance to talk to each other, you know, maybe make some connections that you don't already have, and you know, just walk away with hopefully some really helpful information to help you get through the rest of this crazy season. Scott just mentioned in the chat bar as well that this session is being recorded, so if you're not able to take notes for everything, don't worry. We'll have it available for you to listen to again, and this will be just for Fabio's section, not when you are in the breakout groups. So with that said, I am going to switch over to Fabio, and we're going to let him start his presentation.
Hello, you all. Well, first, thanks for the invite. It's a pleasure to talk to Oregon and Oregon folks. And I've actually spent a week on the Deschutes River, hiked the PCT in Oregon. So I really like the state. So I'm coming here to talk about the ATTA guidelines for adventure travel. And before jumping on the guidelines themselves, just like the story on how it happened is, ATTA is a bit of an international hub for the adventure travel sector. And the governments started approaching ATTA saying, now with COVID, there's like a plethora of guidelines for operating with COVID from many different companies. And it will be really hard for inbound, outbound. It's actually for the industry to know what each other is doing. And that's when the idea for a guideline that would help the companies know that they would have something common in their guidelines came about. So first, with a word of thank you to the sponsor, the contributors who actually make this work possible. It was overall a 2-month process with many, many reviews and stakeholders participating. So Switzerland government, JTB, G Adventures, Backroad, and REI, really, they were part of the engine that made this happen. So the goals of this session are just a little introduction of what the ATTA COVID guidelines are, the approach and the background, and also a little bit of what they are not. And then some ideas on how to use them, and question and answer. Okay, so the approach is COVID, just like, class 5 or gravity is a risk. So we went with the risk management approach because all the companies that have safety management systems can just plug and play COVID as a risk. And over the decade, it has proven it works to manage risk. COVID is new, so it's interesting. Like we manage pretty significant risks with adventure travel, and when something new comes, there's like, it's normal that there's confusion. We don't have the data-based risk management that we have of like decades of centuries of mountaineering, whitewater, and so forth. Another thing that was important in these guidelines is that it needs to fit all the adventure travel companies. So it needs to be broad, and it should stay evergreen. So it should be written in a way that captures change that will happen. So it's about what we want to achieve and not what we need to do right now. What we need to do right now, each company will define their own. And I think what's really unique about this is that it just goes back to the foundation. It's a risk that cannot be eliminated, and it's a risk that will need to be shared with whomever's in the program, staff and clients, and all stakeholders need to participate with informed consent. So that's like the bottom line, is like, know the risk, how do we want to manage it, inform, accept, keep managing. Yeah. During the execution of this, it was really helpful because the whole industry, it was presented and there was a lot of feedback. And there was also a lot of feedback from Cleveland Clinic. This was done in partnership with Cleveland Clinic, and it made a world of difference for us when creating them. And the idea is an overarching guideline that actually sets up the frameworks like COVID, new risk. What we need to do is like protect ourselves where we can, mitigate where we can, and respond when things happen. And how those 3 things happen amid COVID. In terms of diving down a little bit more, like, okay, it's actually tackling screening of participants, of locations, which barriers for contamination we're going to use, sanitation, response, like what's our company, EMS, emergency response, and how we're going to adapt, and the communities where we operate. And a little side note is like the standard, like on the right side of the slide, you see like this fancy blue thing, but then at the bottom you see an Excel looking sheet. There's a self-assessment sheet is provided so companies can map their risk environment for operating amid COVID. The self-assessment tool is not something that will tell you yes, go, no, don't go, but it will show you where you stand in spectrums, and we'll see examples later. And before I talk about how to implement them, I think it's important to understand the layers of risk and protection concept that Cleveland Clinic's use, and it's the same we're using, which is, there's many discussions right now. I know in the US, there's even debate about a mask. So there's debate of like how exactly this virus contaminates people. And Cleveland Clinic approach is like, yep, and we don't need to answer that question to know what are the 4 things we can do to protect ourselves. So face covering, social distancing, cleaning and disinfection, and hand washing. So the idea is don't stress too much about what's the specific way the bug might be infecting you, but just do what you can with all of the tools you have to protect yourself. So this is the medical, picture on how that looks like. And this is how it would look like for adventure travel. So we need to apply the medical approach for layers of protection to where our layers of risk are, tour location screening, customer screening, transport, hospitality, company considerations, like what's your capability to work with different operational procedures, what's the medical situation of both your location and your EMS, and what activities you're doing. So activity is actually just a little part of it. There's a lot more. And the activity specific guidelines, then what they do is a bit of like a framework, initial framework of an SOP. Each one of these layers of risk and the layers of risk and protection are applied to these phases of product operation, and the SOP skeleton, so to speak, is provided. Again, both the umbrella guideline and the guideline that is activity specific doesn't tell you what to do, and that's intentional. It tells you what you want to achieve, like you want to minimize infection during a briefing. So think about this. Think about the distance between your guide and your client. Think about if you're going to do it in a room or outside and so forth. So when you start looking at the examples, you see that there's really no rocket science in this. It's really about applying the layers of protection to what we do on our tour. So from the moment clients arrive, when we're talking to them, they're filling paperwork or not because they did online and so forth. And then there's the details, right? For example, you're going to operate sea kayaking and somebody capsizes. Sure, all distancing procedures now are different. So again, it just goes back to, in the guideline, we'll say, if rescues are a close, you need to do rescues in a close proximity, define how you're going to do them. Consider decreasing the technical level of the activity to minimize the need for rescues and so forth. The other thing that these guidelines do is they're a handrail for information and implementation of your SOPs, your training, how to communicate with clients, and so forth. So far at ATTA, 11 guidelines have been published. One is the generic one that sets up the skeleton, and then these 10 activities had guidelines produced for them. They're all free, downloadable. Like the 11 guidelines plus the self-assessment toolbox are on ATTA's website. Anybody can download and use them. And I'm gonna tell, before looking into examples, like I'm gonna tell one more thing about using them. So I'm gonna be talking for about 12 minutes, and when I'm done, if there's one thing you should remember is these guidelines, they are intended to actually decrease isolation of companies working amid uncertainty. So the idea is to empower companies, large, small, with a benchmark that they can look and just like, you know, what are we doing? Is this good enough? It's not like compare yourself with a benchmark that has been vetted by globally by many, many operators and has been vetted by Cleveland Clinic and ATTA safety management experts, and compare yourselves like, yeah, okay, yep, it looks like I'm doing everything they're suggesting. So it's actually, that's the idea. And there's probably, or there might be some ideas in the guidelines that you didn't think about and you should think about. Another thing that they can do, just like a marketing piece, you can request ATTA for a badge. I am following ATTA COVID guidelines, you know, a bit of a sales pitch from my end, but you can use that if you want. Cool, so now I'll just give you a couple examples on how the guidelines will tackle this. So one group, a family that traveled together and arrived at a company and hire a guy to take them on a backcountry trip. So it's kind of like the minimum risk possible. They're not getting in touch with anybody along the way. So this will present one set of risks for the company. But when you are creating your guidelines, it's like, what's the level of screening you're gonna do is gonna tell you this kind of information. So, and it will tell you if you want to operate this kind of tour or not. And using the second example, it's probably obvious that it's a high risk tour, you know, a bunch of people from different locations with no information about their backgrounds. And they're like a higher risk age bracket, staying in large accommodations. So as you can see, the likelihood of exposure to COVID in the second example is much greater. And I'm just throwing these two examples, just saying, and which tours are you going to choose to operate and which procedures you're going to do? And they're probably going to be very different for these tours, and that's okay. But that's where the thinking needs to take place. For activity examples, what I want to bring is when the risk and safety factors are listed, they're like destination, customer, transport, lodging, food, activity, medical company. So activity is one of them. So I'm just saying this because so we don't get too bogged down in activity. I'm sure people who have started doing this, and probably likely most of you have, you saw that in a lot of ways, when we're out there with the clients is actually the easiest part. The hardest part, it's probably preparation and out of the box situations such as evacuations. But anyway, so on activity, the three key points would be proximity. You know, what's the proximity you want to have, the surfaces, and the operational flow, and how to ensure distancing. The suggestion that I would have, the overarching guideline has an implementation checklist. It's very generic, but it actually ticks all the boxes. And last, just some steps on, I've actually been implementing these protocols in outward bound in Brazil. And so this is the sequence that we use and most people that I talk to use. Like number one is, what's the official guidance? And what the land manager said, like, what could we do? If we wanted to operate, what could we do? Then under that, it's like, okay, we know we can do something. So bring, you know, guidelines or not. So we do a risk assessment of location, clientele, product, what's your program profile, you know, location, tour, everything, activity. Like, so what should we do and what do we want to do? I think that we should not bypass the ethical decision and company decisions on what we want to operate. So what we should do and what do we want to do? Great, we define exactly what we want to do. And then we go to risk target areas. Again, it's just like location screening, emergency services, and so forth in the guidelines list. So we do the risk target areas and we develop our SOPs. And with SOPs, there will be auxiliary documentation such as revised waivers, insurance, flexible cancellation policy. There's no way somebody there's no way the adherence to people not coming if they have symptoms would be the same as if the cancellation policy is not flexible. But anyway, so have your procedures, then train your team and test it. Like most companies that feel better operating, that actually before they went out, they spent some time testing with staff, got great feedback, refined their processes. And super important after that, like the communication part. Shared risks with the clients and staff, informed consent, and clear expectations. It's the whole thing about being pulled out of an airplane. You know, it's a rule, masks need to be worn, and that's the clear expectation. You know, it's not a value or judgment statement, it's just like a clear expectation. And number 4, you just implement, monitor, stop and fix. How's it working? So it's classic safety management system, incident adjustment training, and so on. And you also need to keep monitoring the contacts, you know, the CDC, your country, state, land managers. What can you do? Like, are things changing or not? And that's the part of the monitor, stop and fix. So the last point of this is adventure travel operators were not medical experts. In a lot of the reviews we talked about, Cleveland Clinic and the lawyers, they were very, very, very redundant in saying, you're not medical experts. Do your thing and default medical decision to medical experts. And the lawyers just said, yes, don't try to screen too much, otherwise you might risk discrimination. And the other thing that is super important is your company, each company has a risk threshold. Some companies that have excellent protocols are deciding to operate without masks and screen the participants. Other companies have masks and gloves for everything. So, you know, each company will have the risk threshold and culture. And going back to my first point is just like the thing to remember from this presentation is this tool is to assist and empower operations in this new context. So you know you're not alone, you have a benchmark to compare with. So thanks. I'll stop sharing and jump to your questions.
Thank you, Fabio. I mean, there's so much. This is such a different thing than all of us have ever dealt with. So I know we're already starting the season, but it's always really helpful to you know, hear from an expert and have an opportunity to ask questions. So any questions that anyone might have, you can go ahead and type them in the chat box. And I have a few for you as well. So while we have a minute before any come in, you know, a question about masks. A lot of people are on multi-day tours or might be doing 2 tours in a day or driving shuttles and, you know, dropping one group off and then going back to pick up others. Do you recommend that people can keep the same mask on? Do you need to have multiple masks, or is it okay to wash your mask at night and just, you know, have a daily update?
Great. I think all answers, I'm just going to go back to a framework a little bit. I think what's important is that the companies define a way that their plan will be operational. So if a company wants somebody to have a clean mask at all times, they need to budget the numbers of masks they're going to use. If based on their research, they accept washing cotton masks and every 6 hours, or let's say every day, to make it easy, then they're going to have to figure out the number they need. The only thing that is very practical, I would say, be very clear with clients who's providing the masks and bring some extra because, you know, they go walkabout.
Definitely. And I think that's a really smart way of looking at it. A lot of times it's easy to just put it on the employees and just let them do what they want. But to have a company-wide program just takes all the guess out of it and the stress out of it. So that's a really helpful way of looking at that. Another question, a lot of tours that happen in Oregon are taking place out in places away from medical opportunities, and you could be hours if not farther away. And what if someone starts to show symptoms while you're on tour? Do you have any ideas for medication? Is there anything that people could bring? Like, what should be the first steps to just have in our back pockets for circumstances like this?
Perfect. This is exactly what I asked the Cleveland Clinic lead infectiologist. And he just looked at me and said, what do you do when somebody has the flu in your program? Do you administer over-the-counter drugs based on what? You probably have a medical advisor that tells you which medication to use in which scenario. So I think it just goes back to our WOOFer training or WFA training, which is, and each company needs to have a protocol for like, okay, if somebody shows these symptoms, this is going to be what I'm going to do. And if it includes medication, it should be vetted by a physician. Again, that's what they mean by, right now the buzz is COVID. And probably some of our clients are even more knowledgeable about COVID than we are. So it's different than actually managing, rope friction. So we just need to really embrace the fact that we in the field should not be making those decisions, and those are medical decisions. And I would say it's also good to remember that COVID is not an instantly deadly disease, but just going back to practical work, what they said, just like obviously if somebody has symptoms, separate them as possible. It's not the plague that is going to disintegrate anybody who comes within a 3 feet ratio of them, but define your measures and make sure they can be accomplished. It just goes back to that.
Sounds good. And then there's a question in the chat box from Dave Lacey, and I see that Johnny has, hopefully I pronounced your name correctly, Johnny, has somewhat also responded to. What is your preferred disinfecting solution for water-based activity providers for wetsuits, life vests, paddles, etc.? So Dave uses bleach, but some clients have questioned their choice for possible skin reaction and environmental effects.
Cool. Again, the CDC website, from all the, when doing these protocols, we actually did a little bit of an international tour looking for guidance. The CDC was our favorite because of the clarity of the information on those. So I would just recommend choose one that has been vetted by the CDC. And my preferred one really for things like paddles is just let them sit for a few days. So again, it just goes back to like what's viable based on, the volume of, we know that a lot of rafting programs, circulate really quickly. And yeah, alcohol works well, bleach solutions, water and soap as well. Yeah.
Great, thank you. That's super helpful. All right, so at this point, Fabio, we're going to just say thank you to you for all your insight. Fabio and myself and all of us can continue this conversation on Basecamp, which all of you should be members of, and if you're not, you will be receiving an invite, an email that can give you an invite to get on Basecamp. Because I know sometimes it's, you kind of want to think about it and then have questions. So everyone will be able to ask questions online. Also, you are going to be receiving an email with a couple of things. One, the link to our next forum that we're having so you can register, but also there is technical assistance on the Travel Oregon website, and that can connect you to myself and Fabio. So if you do want to dive deep with him on a certain subject, Travel Oregon will cover the cost for a half-an-hour conversation to have that discussion. But what we're going to do right now is give you all an opportunity to talk amongst yourself. So We did have a lot more people register, and we had created groups with those registrants, and we are down a little bit, so your groups are going to be changing up a little bit, but we're going to put you together. We have 10 minutes total, so I was thinking we could just spend, 5, 6 or so minutes just kind of talking as a group. And I just have a couple questions for you. If someone wants to raise their hand through the hand option, you can definitely talk, and then other people can respond in the chat room. But so there's many, just going to what Fabio was talking about, the layers of risk and protection. I'm guessing that some of you have focused on different areas, and so I'd be curious to know, what is working for all of you? Is it the pre-tour communication? Is it what you're training your guides to do and assess and go into the events? Is it, the conversations you have with people when they show up? So is there anyone who would be interested in just sharing with us how things are going? Anyone? Might put some of you on the spot. Joni, please go ahead and share with us.
Sorry, I put my little hand raised, but because it didn't register.
Yeah.
I created our guest COVID plan. It's specifically for them, letting our guests know what we're doing, what we expect them to do. I put that on my website. It also goes out in every email after they book a trip. And that, I believe, has been the most helpful piece that I created, because they know we've thought it through. They know we have a plan. They feel good that we have a plan, and there are no surprises. The expectations, like Fabio said, the expectations are clear before we ever lay eyes on them. And I'd say that's probably been the most helpful piece for me.
That's helpful. And I see our numbers are down. Jesse, question for you. I think you're the only person I personally haven't talked to. Are you a tour provider joining us today?
I am, but I'm a newbie to the profession. I've done some guided tours in the past, and I'm more interested in just getting myself in a position to be able to do that as a side hustle kind of thing. Or just, I'm here to learn more than anything. But I definitely, I have an LLC. Sorry, outside, Stony River Outfitters. So I've got that kind of staged and ready. But I'm more or less in a holding pattern right now with doing that as a weekend thing. Got
it. Anything that you've noticed, just even, in the small amount of time that you are guiding, that just stands out for you? It's helpful for all of us to just hear what works and doesn't work.
Yeah, it's been some hard conversations for me. Going fishing with friends has been difficult enough, let alone taking clients out. But I just, it's just, I want to be armed with a good way to get through to people that maybe need a shift in their perspective about why they should be wearing masks. And I want to just be armed with that, and so I can handle things in a way that doesn't incite any drama.
Yeah. Fabio, I don't know if you're available. Do you have any insight, if you are, to share about that?
I would say, like, the main thing, and I think it goes back to something that came up during the initial questions, is what's predefined and what's left to be decided. So if a company has posted on their website, these are the circumstances you're gonna use masks, and there's not a debate after. And yeah, so I think it's not a happy place for a guy to be arguing about if something's gonna happen or not. Yeah. And again, I guess what I'm trying to say is, like, the decision happens before clear expectations, and companies choose where they want that to happen or not. But leaving it to this moment, it brings tricky situations for sure. We've seen that in a number of places. Like we've been talking to people who are implementing the guidelines, and they said like in times of uncertainty, it's like clarity is better than anything.
Definitely. I know, and it's all about kind of having the time, as Dave was talking about, just being so overworked, not having the time to update the website and put that information out. So Jesse, you don't have to have those one-on-one conversations. It's already set up. So.
And some companies are doing you step if you don't have an website, like this is like our agreement, it can be like in Brazil, people use WhatsApp. This is the agreement of the COVID rules. If you're not happy, don't show up, or,
Go with somebody else.
Yeah, and so forth.
Definitely. Awesome. Well,
Fabio, how about if someone's not properly wearing their mask? How would you approach that as to politely, deal with that situation if they're wearing it on their chin, or something to that effect?
Oh man, this is like where it's good to be from a Latin country. Like right now, there's a local expression right there. It's like, don't use your mask as a lucky charm. It's a medical device. But anyway, so like right now we have a joke that we can do. But I would actually say exactly as you said, when we mention masks need to be used, is as per their recommended use, which is covering nose and mouth, please. And if that's, yeah, so I would just exactly politely instruct on technique and assume people, it's a technique correction, is not a judgment call. So it's just like if somebody's pedaling in a way that it's exposing the T-grip to their teeth. It's not because they're careless, it's poor technique. Maybe they're careless, but it's not where the guide should tackle it, right? So I think it's the same in a way.
Thank you, that's great advice. Yeah.
All how you say it, right? Definitely.
No, but I think it is like, there's like, I think Brazil and the US, we probably excel in being kind of like a little bit confused on how to deal with this pandemic. I think we're on the same boat. And I think it goes back for tours operators, just like what we do is care for people to keep people safe. There are some techniques that we know that work. This is one of them. So it's kind of like, just like L&T, it's not about the rules of don't trash it. It's about, hey, this is not going to be good for birds to eat. So please give it to me. I'll take it out with me. Yeah. So I think it goes back to, we care for people, pack it as technique education. Yep.
Awesome. Well, thank you, Fabio. This is all super helpful information. And, for Joni, Jesse, Dave, also, the DMOs, you can reach out to talk to Fabio or myself. And on the page, you can see there's the Industry Travel Oregon Togo TA. And we do have another one coming up on the 18th of August about managing disgruntled customers, something that everyone is dealing with. Everyone just wants to be on vacation and doesn't want to deal with, keeping everyone safe. So we're going to be diving into that more on the 18th. Billy, question, your mic is on. Yep.
Yeah, can I ask just real quick if this next one on the 18th has anything about de-escalating in it?
We can bring that up with the speaker, and I know it's something that he has dealt with, so we can definitely put that in. And we will be having, you can register for the next forum, you can put your questions in there as well on that, but I will book note that when talking to Dan. So yeah, so we have a minute left, and just wanted to share, we'll be continuing the conversation on Basecamp for anyone who wants to ask more questions or share more details as well. So any last words from Travel Oregon? Otherwise, we have one more screen, just thanking everyone from coming and participating today in our first online forum. So definitely want to get feedback from everyone so we can make sure that the ongoing 3 that we're offering fit your needs and interests. So yeah, hoping to see you all in 2 weeks. So thank you again.
Thank you.